This week on Health Matters, we're shining the spotlight on a very worrying trend in South Africa. Now, recent data reveals that South Africans are averaging a staggering 10 hours a day in front of our screens. And that's one of the highest rates worldwide. Now, the health implications are also alarming, with excessive screen time linked to increased stress, anxiety, and depression. And joining me now to help break down the risks and also consequences is Doctor Alicia Porter, a board member of the South African Society of Psychiatrists. Thanks so much for coming through. Welcome to Morning Live.
Thank you. It's lovely to be here on this fresh Monday morning in Johannesburg.
I must say, when I saw the team had decided on this, I was like, absolutely, it's about time we spoke about this. Because, and I'm not sure, I know on the device that I use, it actually gives me on a Sunday morning a weekly summary of how much time I spent online. And the first time I saw that, I was shocked, and it really, snapped me out of my slumber there, because I was spending something like 18 hours a day.
Yeah, and that is the reality. And the problem is that when you're on your screen, either doom scrolling or on social media, time just goes by so quickly. And so you don't realize it until you take stock of your screen time and realize, wow, I've actually spent all of that time. But spending that time actually puts us at risk. Our mental health, just as South Africans, as a nation globally, the trends are showing a decline. And I definitely think that screen time has, I'm not saying it's the cause, but it's definitely contributed to where we are.
Because think about it, Dr. Porter, and I realized in my own case, it meant that every waking hour, because at this point I was struggling with sleep, so every hour that I was awake, I was actually online in one way or another.
Yes, and it's like this always on kind of thing where your brain never switches off. And, like you say, you were struggling with sleep, but being on the screen doesn't help that, because even just the light from the screen, I often tell parents, we need melatonin in order to sleep. Melatonin needs darkness. The light from the screen, we're not going to get, the melatonin being released. So even just trying to sleep becomes a challenge with the screens being always on. I mean, you get up in the middle of the night to go and use the bathroom, and then suddenly it's like your phone knows, and then the light comes on. And again, it's another hour before you then, get back to bed because there's the email that came on, or so it really is this always on, but that's not really great for our mental health and just our overall well-being.
So how can we best deal with this? And I'm thinking especially about young children, because they also have access to devices, whether it's phones, tablets, or even television. So how do we manage that?
So, I mean, before, in terms of managing it, I just want to highlight, particularly for children, how much more of a risk this is, because unlike adults, this is a developing brain. And so that excessive screen time is not just lying there latently, it's actually impacting like language development, social skills, even just the ability to pay attention, focus. All of those things become impacted in children because this is a developing brain. And so, in terms of what do we do, I think particularly as parents, we need to first, before we expect this from our kids, we need to learn to model the behavior. I don't know how many times I said to my kids this week, we are going to be talking about this today. This is far too much time on the screen. But they watch us. And not what we say, but also what we do. So as parents, we need to begin to model this. But also, there's nothing wrong with having a family, what is our screen time policy here? But it's very, very important that we start to create device-free zones, whether it's going to be at the dinner table, no phones in bedrooms, but we definitely need to start limiting and filtering for our children. And as parents, we are very central to how our kids then navigate screens, because we can't say no screens until 21. That's not practical.
So brings me to my next question, and let me just preface this by saying I'm not coming for parents. With regard to how early or how late should you start your children on these electronic devices? Because, and we see this, whether you're on a flight or whether you are walking through a mall, visiting someone, the children are being babysat by Cocomelon from a very young age.
Yeah. And that really is the challenge. But, in line with sort of international standards, guidelines, definitely no screens for kids under the age of 2. Their brains are still very early, and it can actually disrupt even their milestone development. So no screens, and the under 2s is a non-negotiable. And then it should be scaffolded. So between the ages of 2 and 5, it should be on average an hour a day. I think we are far out with that. And I think COVID didn't help us. And then, over the age of 5, they say an average of 2 hours a day is practical and doable, but also that's not only for educational content. Obviously now with schools moving online, that's something that we have to navigate. But in terms of like being on social media, playing video games and those kind of things, 2 hours a day definitely should be maximum. Because what actually statistics are showing us is that children who spend more than 5 hours a day have a 70% higher risk of getting things like anxiety, depression, suicidal thoughts, and even eating disorders is on the increase, particularly with children. Excessive screen time is one of those contributing factors.
And then adults, because adults are equally struggling.
Absolutely, also with anxiety, with depression, with burnout, but even like attention, concentration, focus, all related to the amount of time that we spend on the screens. And if you think about it, it's a 24-hour day. If we're spending an average of 10 hours and not on educational content, but just on doom scrolling, comparing ourselves to others,
because you go down a rabbit hole.
You go down a rabbit hole, and before you know it, 12 hours have passed, and we don't really have much to show for it. And then, we are looking at TikTok and the influencers, and it really has changed the landscape significantly.
So let's perhaps just bottom line it by looking at the risks of excessive time spent, on our devices and looking at these screens. And then, of course, what is healthy?
And so I think healthy is about finding the balance. And, I often say to parents, children don't need perfect parents. They just need consistency. And so if we are consistent, and sometimes just small changes, like putting down the phone when we're having a meal, that's a small change that will create a big shift. But then we're sending a message to our kids that I'm present, and actually it matters, but it's also promoting face-to-face connection, and I think that goes a much longer way than this idea that there shall be no screens. It's about finding that balance between healthy usage, and I think that is the biggest challenge, that it's not about you cannot do it. It's about how do we find this balance, and I think balance is found with consistency.
Well, such an important conversation. And just the final question, perhaps just in terms of the strategies that parents can apply. I hear you say, maybe at a certain time, just put away all the devices. Anything else that maybe parents who now have a child who's now used to watching the screen and being glued to it, how do they wean their kids off that?
So, I think it's important, it's weaning. So we have to establish what it looks like. So even if you are trading screen time with balancing it with physical activity, there should be the device-free zones in the house, but also in terms of like promoting the physical activity, and also kids' devices should not be charging in their rooms. It should be in common spaces, or even there should be a handing in of devices, because children, unfortunately, we are the braking system for them. We need to help them, because it is a myth that they are able to control it. We have to be central to how they manage and how they control.
Well, so informative. Thank you so much for stopping by, Dr. Alicia Porter, a board member of the South African Society of Psychiatrists, speaking to us about the dangers of excessive screen time, and of course, what you can do to wean your children, and of course ourselves, so that we spend less time, and when we do spend time, we spend it constructively.